Sabrina Germain is in London. She is a senior lecturer at the City Law School at the University of London. Sabrina, thanks for your time. I just read that 81,000 deaths at the very minimum is the latest figure, and that's the most excess deaths that England, the UK actually as a whole, has suffered since World War II. That tells one story. What about those who are providing care? What do you know about the pressures on them?
Well, that's absolutely true and sad. Unfortunately, the pressures are mounting on healthcare workers as we speak. You highlighted very well the pressures that are mounting on the workers, but also on the resources themselves. And that's what I usually focus on with regards to my research. And unfortunately, this is a very sad test case. We see London hospitals being overwhelmed. We see patients or talks of patients being discharged into hotel rooms in order to free up ICUs. We see complete hospital trust being reallocated to only COVID-19 care. And these healthcare workers are feeling the pressure. A lot of them are voicing their concerns on different social media, but there seems to be very little attention paid to these poor healthcare workers at the moment.
Many staff members of the National Health Service, they say that there are many indications of how they have been disregarded by the government for years. I want to give one example to the viewer. Nurses had, for a certain amount of time, been allowed to park their cars next to the hospitals where they work for free. Now they're being charged. They haven't been given raises which are in line with inflation for years. The NHS as a whole accuses this particular government, which has been in power for about 10 years, the party itself, the Conservative Party, of being partly responsible for the crisis the NHS is suffering at the moment. Would that be fair, that view of the NHS itself?
Well, I think you are correct in saying that the NHS has been greatly underfunded. And that has, of course, roots prior to the current government. And of course, we can date it back almost after the 1970s, unfortunately. But most recently, the 2012 healthcare reform clearly took a turn into rationalizing care and making sure that it was patient-focused, but also bringing in kind of the private sector to chip in, but not supplementing any funding to support the current workers or the current resources that are needed. So obviously, we see a crisis that is due to multiple factors: underfunding, lack of investment in human resources. Brexit is also playing a role, as we've seen a lot of staff exit or feeling unwelcome after the Brexit vote. And also now we have a pandemic we're dealing with on an unprecedented scale. So although the NHS is very well equipped to deal with a lot of patients, it has been running low even prior to this public health crisis.
What do you think is the solution in terms of how to deal with COVID-19 patients? I mean, down the road in years to come, that could be a different matter. But is it a matter of just sort of applying a Band-Aid to a very severe wound in the hope that it will keep the NHS functioning to the extent that it can serve those people who have COVID-19, apart from all the other operations and all the other procedures that have been put on the back burner because of how severe the crisis is? What needs to be done right now, or can anything actually be done, considering the NHS itself says we simply don't have enough people?
Well, of course, there are limited resources, but things need to be done. Responsibility needs to be taken on the part of government to provide more support to the NHS staff. There's now talks of allocating resources that are becoming extremely scarce on a lottery basis per patient, meaning if a hospital becomes completely overwhelmed at a very critical point, we're not talking about regular times. Obviously, we're talking when the situation we're currently facing in London, for example, where we would need to make choices among patients, we would allocate care on a lottery basis. This is rather alarming. So resources need to be mobilized. We need to prioritize healthcare worker in the vaccination effort. This is something that is currently undertaken by the government, but is very late in the game. We need to make sure that NHS staff are tested properly, and that we provide more resources to have more staff to help with the pandemic. So yes, things could be better, and resources could be better mobilized as well.
Sabrina, thank you so much. Interesting, isn't it, that we're talking about the fifth or sixth biggest economy on the planet, and it itself is struggling. Sabrina Germain is from the City Law School at the University of London. Take care.